अस्सलाम वालेकुम। कैसे हैं आप लोग? खैरियत से हैं? आज मैं स्टार्ट कर रहा हूँ लेक्चर सीरीज़ और मेरी कोशिश होगी कि मैं लेक्चर्स को बहुत ही इजी वे में आप लोगों को समझाऊँ। तो टॉपिक आज मैंने सेलेक्ट किया है वो एंडोडोंटिक इमरजेंसीज है। व्हेन वी टॉक अबाउट एंडोडोंटिक इमरजेंसीज, तो इसमें फर्स्ट ऑफ ऑल इट्स एन related emergency which is not a life threatening emergency usually. When we talk about dentistry, we don't usually deal with these emergencies like life threatening emergencies. But the most common problem with, you can say, as far as dentist is concerned, is to treat the patient's pain. Majority cases में जब पेशेंट हमारे पास आते हैं, they have a problem with a pain. और उनका एक बहुत बड़ा मसला होता है कि पेन से रिलीफ चाहते हैं। मेरी कोशिश होगी कि मैं ब्रीफ आप लोगों को समझाऊं और सिनेरियो बेस्ड जो है वो वर्किंग करके बताऊं कि एक अगर केस आया है पल्पाइटिस के साथ, उसका क्या मैनेजमेंट होगा, स्वेलिंग के साथ आया तो उसका क्या मैनेजमेंट होगा। So we can divide the emergencies like pre-treatment or pre-root canal emergencies, or inter appointments or during the root canal emergencies, or post-obturation or just after the root canal treatment, these emergency and emergency which are not dental related. So you have to develop a proper system to make a good diagnosis and ultimately management of the case. Most importantly, you have to be assure the patient that it will be all right soon. Number two is that before you start the treatment, the most important is to give a profound anesthesia. So when we talk about pre-treatment emergencies, for example, if the patient is suffering from irreversible pulpitis, the best treatment is to do pulpectomy of the tooth. You are supposed to remove the complete pulp from the root canal system. You can do out of occlusion, but a very good important thing is to give analgesic to the patient. So when you talk about pre-treatment emergencies, patient की कॉल आती है कि मैं बहुत ज़्यादा पेन है मुझे, usually patient suffering from irreversible pulpitis. The best treatment is to remove the complete dental pulp and do a root canal treatment, maybe a single visit or multiple visit. Another is that a patient might be coming from pulp necrosis, and pulp necrosis without swelling, it might contain vital tissue as well. So complete debridement, complete cleaning and shaping is important, and analgesia is again very important. Another is the, you can say, emergency is the pulp necrosis with localized swelling. You can achieve drainage through canal, which is usually not common. Incision and drainage is a very good option if the patient is suffering from a localized swelling. Canal debridement is very good. You are supposed to do complete cleaning and shaping, and intracanal medication is also very helpful in these cases. But always give good analgesics to the patient, anti-swelling to the patient. This is one of the examples you can see. There's a localized swelling, so it's always good just to give incision and drainage to that area, as well as to give painkiller to the patient and do complete cleaning and shaping of the patient. Sometimes you need to give a drainage for a few days, so the drainage can occur. The pus can drain easily even after when the patient is not in your surgery, and this area will not completely close without the substitution of the swelling. Pre-treatment emergencies, pulp necrosis with diffuse swelling, patient with suffering from systemic signs, symptoms, maybe fever, malaise, and there's a maybe patient may be suffering from a massive enlargement of the swelling. This condition may be life-threatening. It might uh, obstruct the airway as well. You can see this condition of the patient is not good at all. So you are supposed to do complete incision and drainage extraorally or intraorally, intracanal medication, and IV antibiotic intravenous, hospital admission sometimes required. So this is a very important to understand that if the patient is suffering from fever and their systemic involvement is there, always try to appoint a patient and deal with these emergencies in hospital setting. One is the intra-appointment emergency or during endodontics, also called flare-ups or pre-operative pain. The best indicator of flare-ups. Always pre-warn the patient. अगर आप पेशेंट को पहले से बता देंगे कि भाई पॉसिबिलिटी है कि आपको swelling में पेन हो सकता है ड्यूरिंग रूट कैनाल ट्रीटमेंट, तो इट्स ऑलवेज सेफ एंड पेशेंट इज ऑलवेज also mentally prepared. Analgesics or long acting anesthetic agents are also very helpful. Complete debridement and incision is sometimes necessary. Sometimes the patient, even after obturation, patient कहता है कि डॉक्टर साहब after root canal complete कर दिया, patient still, but the pain is still there. So the active intervention is suddenly required. Your reassurance is very important. Sometimes you can say one third of the patients always have some pain after obturation. So always inform the patient that even after root canal treatment, the sealers might go outside. Your mechanical instrumentation might cause this swelling as well. So always give pain and the patient painkiller as well as inform the patient that it might happen. Be aware of cracked tooth, periodontal abscess, sinusitis, and TMJ, and food packing as well. Sometimes these after root canal treatment, this might uh, cause patient's pain on the same tooth or maybe in some other tooth, but the patient is not aware. Patient को तो यही कहता है कि patient डॉक्टर साहब पहले भी पेन था, अब अभी भी पेन है. So always look for other thing as well: cracked tooth, periodontal abscess, sinusitis, TMJ, and food packing. So that was all about endodontic emergencies. When the patients come with pain, most of the time you are supposed to do complete cleaning and shaping, and sometimes you are supposed to do incision and drainage in cases of necrotic with localized swelling. But sometimes the patient is having systemic involvement like fever and malaise, and then you're supposed to give IV antibiotic, or you might need to shift the patient and hospitalize for IV antibiotic. Okay, thank you very much for listening this lecture. uh, Allah Hafiz.